Turkey has become a leader in medical tourism growth. It's curious why and how this happened, and why people go to Turkey for treatment. We tell you what the country has achieved such results, and why more and more foreigners are going to Turkish clinics, as well as what technologies, methods, and prices are there. Subscribe to the channel. We have many videos on medical tourism in Turkey. If you can't find info, call the number at the end of the video and ask in the comments. Why do we love Turkey? This is the sea, sun, pleasant nature, and low prices. That is why millions of tourists come here and continue to come. The authorities only had to come up with how to monetize this tourist flow even more. And besides, among other things, the Turks decided to prioritize foreign medical development. Because who said everyone must go to Germany, Israel, and South Korea? Let tourists in Turkey combine business with pleasure, relax, swim, and get treated. The level of development of Turkish medicine has always been good, but for the past 2 decades, new clinics have been built in Turkey, the latest medical equipment has been purchased, and new doctors are being trained. Of course, first of all, for the Turks themselves, these are billion-dollar investments. But the Ministry of Health also ensures that as many foreigners as possible use Turkish medicine. This direction has been made strategic at the government level. The main efforts within the state programs have focused on improving infrastructure, enhancing the quality of services, and attracting foreign patients, including through information campaigns in the media, simplifying visa rules, and even through special offers from Turkish airlines. The state provided tax incentives and subsidies to medical institutions in order to improve the quality and accessibility of services. Separately, we note the creation of modern medical centers equipped with state-of-the-art technology. All these measures were supposed to improve the overall image of the country as a place with quality healthcare for foreigners. Did it work? Judge for yourself. Foreigners willingly come here specifically for treatment and wellness programs. Turkey is already among the global leaders in the treatment of oncological diseases, infertility, neurosurgery, ophthalmology, aesthetic operations, dentistry, and hair transplantation. The number of medical tourists keeps growing. The only exception was 2020. Due to the pandemic, only 400,000 foreigners could come for treatment. In 2021, there were about 700K, and in 2022, there will be twice as many. Now, 5% of Turkish budget revenues come from medical tourism, so foreigners bring them. I think that's why those who want to improve their health in Turkey are not hindered in obtaining a residence permit, unlike other foreign passport holders, who were massively refused to extend their residence permit in the 23rd year. We won't focus on the reasons. Many bloggers discussed it. We prioritize something else. Those who seek treatment in Turkey, conversely, are greeted. Volumes to rise. International Economics Journal published report on forecasts for meta-tourism in Turkey. The authors promise that by 2025, the industry's volume will grow by 1/4 annually and may exceed $1 trillion. In terms of the latest treatment approaches, Turkey has a long and extensive list of offerings that can be discussed and explored. Today we will demonstrate only a few significant accomplishments. Therefore, the techniques that Turkish clinics can proudly showcase. In Turkey, artificial insemination using ICSI and IMSI methods is actively used. Their success rates are higher than those of conventional extracorporeal fertilization. The technique of sperm selection using a microfluidic chip was first employed here, and it is now widely utilized around the world. In the year 2019, the initial kidney transplant procedure utilizing the Da Vinci robot, an extremely intricate and precise device for surgical manipulations, was carried out in Turkey. Now such installations are used by 35 clinics throughout the country. Turkish ophthalmologists at the Memorial Clinic were the first in the world to perform a corneal transplant without sutures and long subsequent patient rehabilitation. It was feasible to accomplish this with both donor and artificial cornea. Since 2011, a total of 5 successful face transplant surgeries have been carried out at the Agdenes State Clinic. No other clinic in the world can boast such achievements. In Turkey, they were among the pioneers in adopting laparoscopic hip replacement, utilizing stem cells to treat arthritis, and employing hyperthermia therapy for the treatment of advanced stages of stomach cancer. Doctors in Turkish clinics handle the treatment of patients who cannot be assisted in numerous other countries. One of the brightest examples is the treatment of cancer, in particular brain tumors. Here, patients who have received discouraging predictions in their country of origin can, if not fully healed, attain stable remission and enhance the quality of life. Turkish medicine has achieved more, but they claim that in terms of medical service quality, Turkey has caught up with advanced countries, and maybe even surpasses some in certain aspects. One of the primary benefits of medicine in Turkey, which is why foreign patients continue to come here, is the affordability of the prices. They are lower than in other countries. In Turkey, almost everything is cheaper, both complex surgical operations and simple health procedures, and rehabilitation programs after injuries. Examples: in the 23rd year, operations to restore figure after childbirth cost in Turkey from $9,000 and in the UK from $18,000, in the USA from $15,000. Also with other aesthetic surgeries, rhinoplasty, nose surgery, in Turkey costs an average of $3,000, while in the USA it starts from $7,000 and in the UK from $5,000. Meanwhile, the Turkish cost typically includes everything, not just surgeons' work, but also materials, medications, rehabilitation, clinic stay with meals, often with an accompanying person, and even airport transfer. All. The patient receives all-inclusive, not separate invoices for each and every manipulation. This is where Turkey differs advantageously from the likes of the USA and the UK. The final bill can increase several times if there are unforeseen complications or if additional procedures are needed. Dentistry in Turkey is on average 60–70% cheaper than in European Union countries, and the quality is noticeably higher than in post-Soviet countries. Plus high-performance indicators. 98% of dental operations in Turkey have a positive result, and the most in-demand services are prosthetics, implantation, veneer installation, and teeth whitening. Ophthalmology prices in Turkey are about 1.5 times lower than in Europe. For example, laser vision correction costs $1,000, $1,200, vitrectomy about $1,700, intraocular lens implantation $700, and in everything. See rates for other treatment types and directions in articles on the website and in videos on our channel. And let's not forget about one more advantage of Turkey. It is as important as prices and quality. This is the environment. Patients have the opportunity to combine their treatment here with relaxation in an excellent climate on the seaside, which in itself is a powerful factor for recovery. If permitted by the doctor and feeling good, you can visit numerous fascinating sites, try unique dishes, and enjoy the breathtaking views of incredibly beautiful places here. And this is what most other countries, strong in medicine, lack. If desired, all this can be included in a package tour for medical tourism. You can get a consultation on a specific direction of diagnosis and treatment in Turkish clinics from the company Healthy Turkey, which provides a full range of expert-level services for patients from other countries. Healthy Turkey is ready to assist you from arrival, handle formalities so you can focus on your health. Subscribe to the channel and don't miss new videos on medical tourism in Turkey by Healthy Turkey, covering various aspects and directions of medical tourism in the country.